ask someone, my colleague, to speak to school or arrange something like, because you are single at the moment, but your health is priority as well. They might pick up your son and might bring in the private in the temporary accommodation as well.
I don't think that will work out. My child has special needs and is particular, so I want to do it myself. Nobody has ever done it for me.
Oh,
so
definitely, I'll try to get that help for you. In the meantime, I'll try to finish my assessment. Is that okay?
Oh, go on.
Okay. All right. So you brought in the hospital. Can you give me a quick recap what happened today when you brought in the hospital?
Well, I've been talking about this for too long and I'm getting angry and frustrated. Okay. I was asking A&E and I told them at some point I had stomach pain and people at work noticed and they had to call the ambulance for me. The ambulance brought me in and now I feel better. I want to go home.
Oh, bless you. You're such a strong person. Definitely you're going through that. I do understand you also got type 1 diabetes, isn't it, from my notes?
Yeah, I had that since I was 13. I've been managing it very well.
Oh, okay. So how are you managing? How are you coping?
Well, I take insulin and I'm coping okay.
Good. Well done. So by any chance you took your insulin today as well?
Well, sometimes I skip. This is one of those days.
Okay, so you skip your insulin today.
Sometimes, yeah.
Sometimes.
But I skipped today too.
I'm sorry to ask you, how many times it happened before as well?
I can't remember exactly, but I know I skipped today, and for some reason I had, you know, an episode of, you know, feeling sick. They called the ambulance, but I'm fine now. I'll take my insulin when I get home.
Okay, definitely I'll come back to that. And by any chance, have you given a thought why we want to keep you in the hospital? Why they want our assessment?
Well, I was told in A&E my sugar is quite high and they need to give me insulin to keep it down. I said I have insulin at home. I can take it at home.
That's good. You know a lot of things about your condition and when sugar is high, definitely I'll come back to that as well. Apart from that, I'm a bit worried about any other symptom. You're feeling like dizzy, lightheaded at all?
Doctor, I think I'm fine now.
Any blurry at all?
No. I'm okay.
And you mentioned you got stomach pain. Still,
I had, but it's no longer there. Yeah.
Is that okay? Can I have a quick feel of it?
No, doctor, I don't want any examination.
It's okay. No problem. No problem. It's okay. So I have your blood investigations with me. Okay. So the results are back. I want to explain to you what is that okay with you?
Well, you can go ahead. Yeah.
As you mentioned that you got type 1 diabetes, we run some tests to assess any dangerous complications of that one. Okay. So your blood, which I got, which shows the acidity in your blood is quite high.
What does that mean, doctor?
Let me explain to you. Sometimes type 1 diabetes do have their complications. At the moment, you're going to one of those complications we call DKA.
What does that mean, doctor?
Okay, let me explain. Don't worry, let me explain. DKA is diabetic ketoacidosis. As its name says, acidosis means sometimes due to some chemicals, our blood can get acidotic and it is potentially dangerous condition. But don't worry, you are in a safe place at the moment. We can control it here.
Can I not just do this at home? I mean, is insulin right?
That's a brilliant question. As you mentioned, you take insulin, you get fine, but this time your blood shows that insulin won't be enough. We might need to give insulin through your veins and we might need to give you fluid now because we are very worried about you. We have to control it and monitor.
But I feel fine. I can drink water and I can take my insulin.
That's a good thing. Still, you can drink water anyway, definitely. We'll make sure we'll get you everything here, whatever you want to eat and drink. Okay. But
2 minutes remaining.
At the moment, we are concerned about your health as a whole. I just want to tell you any other specific reason apart from that you want to do.
Well, doctor, I might have not mentioned, but I'm in the middle of planning, you know, I'm planning to get married and I have a lot, you know, to do.
So you are going to get married?
Yeah, soon.
Oh wow, brilliant. So congratulations. So that we must treat you as soon as possible so that you manage your marriage.
Well, 3 days away.
Oh, we got time. So definitely we start our treatment now. Let me tell you benefits if we start treating you now.
Okay.
If we give those everything, fluids and insulin to your vein, you'll get better in next 48 hours and maybe in 3 days time, you will be totally perfect. And you might be able to attend your marriage. I do agree that you might need to plan a few things, shopping and everything, isn't it?
Yeah.
But if I show you some online things, you can do that as well. I can.
Well, doctor, I don't think this will work out. I still need to go home.
I do agree, definitely. Yeah, do agree. So, first of all, I would say I totally understand where you're coming from. You're at the moment annoyed as well because of this whole what happened to you, the weight plus. That makes sense. But we are worried about you. At this point, I want to tell you, it is a very potentially dangerous situation. If we don't treat you, you might lose your consciousness and you might go into the coma. Do you understand that?
Well, I understand, but I feel fine. And I think I'll go home and manage.
Oh, bless you. At this point, definitely, I need to think of alternate plan for you. For that, I need to speak to my consultant, and I want you to discuss someone at your family as well. Can you do that?
You're just keeping me longer. You know, now you're talking to somebody else.
That I'm keeping you longer. The point is that we are worried. I'm afraid if we send you home now, if you go home, I'm afraid you might end up in the hospital in unconscious state in the next 48 hours.
To the next station.
You was very tough. You were very tough. You were giving me more. Well done. Good acting. How do we know we have to mention and discuss? Because it would be given in the
written, yeah.
I told you the given in the cubicle so that I assume that I've seen that results and I mentioned that. So guys, what do you say about this consultation, how it has been done and how you can do, what are the positive? So the Victor was making me something.
You said that to me tough.
Oh, it's okay. You done well. Thank you very much, Victor. But it was way tougher than even from the real exam.
Your composure.
In the refusal structure, which I have done in the exam, it was very tough than that one. Well done, Victor. Just stay there. But the thing is, yeah, Victor was really in refusal. He don't want to stay. And actually, he was doing the right way, how sometimes you can see patients will be acting. And definitely because they are, so whole idea of doing this consultation and telling you is that when someone is going through potentially dangerous situation, I didn't mention discharge against medical advice. In DK, I will never. Because as a doctor, I know that if somebody is going home with a DK, I never recommend anyone to mention discharge against medical advice, mention alternate plan. And I mentioned the alternate plan. So when you would be assessing capacity or anything, so let me tell you how we discharge patients just for the educational purpose. So in my A&E department, so how we discharge patients. So there is a form. I'm going to share the screen, and that form shows how to